take 5 minutes for comments from the audience. Yes, Luke.
Now that you have this kind of broad spectrum of audience attendees in front of you, what would be your biggest request to the community?
I think, one of the biggest challenge we have is how Dr. says at the beginning, is to make an alignment. And also, sometimes people that lives in the United States has more power than we do in our countries. So you have the power to convince people here in the United States to have a better idea of what is happening in our countries. So I think if, the power of one, like Dr. Karen did, with us in our country, and if we can have more people like her committed, to spread the voice out of, what is happening in our countries, it will help a lot.
The same questions? Is this the answer the same question for same questions? Or I think we are suffering in the same way, and we are worried for sustainability, and we are looking for lots of support, like here, committed people, and then different country has different problem. Right now, we did lots of advocacy and introduction and meeting, even when Dr. Karen was with us, and we went to INGOs and big FAO, bigger organization, public health officer. There's a wonderful program. It's a really good program. And then after, they just forget. And it's very interesting. One of our chief public health director, and when we explain how we do the fluoride application to prevent the tooth decay, she said, I want to have that too. And we did apply. Then after, she never cares. Oh, we need funding first. So I think the problem is the same. But slow and steady, it will eventually reach this, and we can see the smiling face in the world. Thank you.
Samson, you want to comment?
I think the best request we can make for the group is what my friends have just said, is commitment and having the passion to spread the smiles worldwide. Thank you.
Good. Other comments? Priyanka.
Hi, this question is for Samson. I'm curious to know, in a community, a rural community from like Masai, where you're from, is there as much of an influx of junk food in a Western diet as we might see in the other countries that were presented, like Nepal and El Salvador? And if not, what is the community's perception of junk food, and how did you convince or educate them that it's going to have poor oral health and overall health outcomes?
Sure. To answer that, there's a challenge there, because when the people go to the market, they will get a lot of junky foods to reward their kids since they've been away the whole day. They'll bring a lot of junky foods, and there's also shops. There are no centers. The households are the one which sell sweets to the kids. Have I answered you?
Yes, Saskia.
Yeah, I'd just like to echo a little bit, because I think we heard 3 wonderful presentations. And what inspired me right now really, and I think, Karen, this is really a challenge, more so than oral health, to nutritionists, I think. Mm-hmm. And just looking at the big picture, we have we have new guidelines that the World Health Organization is about to make them public. And that is the reduction from 10% to 5% for free sugars. And if those guidelines can be implemented, I think the oral health definitely will benefit from that. So I think your programs will benefit from it, but the guidelines have to be implemented with the support of the ministries of public health, with the support of policymakers. So I think if we were to spend a lot of energy, because you're working at the community level and it's very focused, but if we want to make that more of a broader public health intervention, we have to look at the big picture. But what worries me also is that in some countries, the transition, the nutrition transition is just coming in. And that is very important. Because look at Mexico. It took a decade to go from, not so fat to being the fattest in the world. So I think that's something that we have to look at it. And the advocacy has to be towards nutrition. And oral health has to be aligned with those policies because we will benefit from that.
Right, great, thank you. Let's see, one more comment, question? Martin, do you want to go?
Yes, I would like to speak for children. If I were a child, which I was at one time, long time ago, I wouldn't care about sugar or whatever. I would care about having a toothache. And I think if we at least measure our success at that level, how many children have had a toothache or more than one toothache or no toothaches? Not caries free even, just no toothache would be a good way to measure success, because that's what the patient, that's what the parent cares about most. And if you can use that as your focus, not a cavity, just keeping the mouth from hurting as long as you can.
Good, thank you. I think that's a nice way to close this morning's session. I think all of us can say we believe in having a world in the future where children can grow up without having to suffer from mouth pain, without the mouth pain interfering with their ability to eat, to sleep, to grow, to develop. So that's what we're all going to commit ourselves to. Thank you. So now we have, let's take a 10-minute break, and then outside we have student posters that you'll be able to look at, talk to the students, ask them lots of questions about the work they're doing, and then we're going to come back and Dr. Habib Benzian will do the wrap-up presentation for the morning. Thank you.